Thank you for inviting me to this virtual place. It's always very strange to talk to your computer. It is not my voice. I am French from Marseille, but I use a modern translation. Thank you for all that are listening in live, so I thank you again for having me invited to these conferences held at your initiative in Toulouse in France. Tonight's topic is the history of our discipline. That is to say, the history of orthopedics and traumatology that I will try to give you. Briefly, if at all, if it is possible to draw up a few slides about 2,500 years of surgery. But we will see that in the case of orthopedic surgery, things can be shortened. These are the main steps we will discuss. And 5 steps before Nicolas André, we will see who Nicolas André was. Until Ether Day, which is the day of the first recorded general anesthesia. Powerful from the middle of the 19th century until the First World War. We will reach the modern era. We will then consider what the future of musculoskeletal surgery might look like. So for centuries, surgery has been obviously limited to the treatment of trauma, i.e. fractures and wounds. Hippocrates, Galen, and Ambrose Père gave us the rules for the treatment of these different traumas. Everyone knows these images of Hippocrates trying to reduce a shoulder dislocation by putting a ladder under the patient's armpit. Galen obviously followed him in this adventure. Ambrose Père, the famous surgeon, 16th century barber that everyone knows, to whom we owe a special, almost modern treatment of wounds. In the Middle Ages, surgeons were barbers, including specialists in the treatment of hernias, specialists in the treatment of bladder stones, i.e. bladder lithiasis. Others specialize in cataract treatment. And among other specialist barbers we had those we called romanciers in French. In England, they are the bone setters, i.e. empirical practitioners, who had the power to diagnose and treat fractures and other osteoarticular disorders. Their art was transmitted, as for all barbers, by word of mouth. It should be noted that at the time, surgery was practiced by barbers, and the universities did not allow only doctors and clerical doctors, i.e. believers. The barber surgeon was very often subject to an imperative. This was an extremely frequent occurrence, which in reality depended on the success or otherwise of his therapeutic procedure. That is, he had to leave the field of action very quickly because if the operation was done in public, failed, the punishment could be quite violent in the neighborhood. Who could immediately lynch the surgeon? We see that the profession of barber, like that of surgeon today, is not an easy job. Among barber surgeons, especially among the families of bone setters, one can note that of Hughes Owl Thomas, who gave his name to the famous Thomas necklace, a cervical collar, as the spine could be, the site of the famous Pott's disease of tuberculosis, and cause major deformations. The Thomas necklace was a great help in this case. We come to Nicolas André. Nicolas André was dean of the faculty of Paris. In the 18th century, i.e. during the Enlightenment, we passed the Renaissance and its masterly anatomical discoveries, notably with André Visale, we are now in the century of the National Academy of Surgery, which was founded in 1731. Nicolas André is the dean of the Faculty of Medicine in Paris. You know that at that time we still thought that the diseases were caused by a imbalance of the humors whose most aggressive treatment was to rebalance them to proceed with bloodletting. In other cases, purges are carried out, more laxatives were given or patients were put in the fresh air. They were given a good diet according to Hippocratic or Galenic principles. Diseases were also thought to be of an almost divine order. The disease was a kind of punishment. All the families who had deformed children thought it was a divine punishment. Divine punishment because probably the family had done wrong actions to inherit sick or deformed children. Nicolas André will take a new look at these pathologies. He will be interested for the first time in to all these childhood diseases. You can see that it is congenital deformities, infantile paralysis, scoliosis, or other chronic joint conditions such as tumors, white, Pott's disease, i.e. advanced tuberculosis. He wrote a remarkable work in which he used the name orthopedics for the first time. This book is called Orthopaedics, or the Art of Preventing and Correcting Deformities of the Body in Children. This book was a work for the use of doctors, but also of all parents and families who had children in their care or in tutoring. The word orthopedics is made up of two roots, the root ortho, which means right, and the Greek root pagan, which does not mean foot but child. So orthopedics is the art of preventing and correcting deformities in children. All societies in the world have this tree as an icon, which is stabilized by a stake and synthesized by a rope, because the principle put forward by Nicolas André was to use the growth of children, by splinting them, to try to make them grow straight, as we do with vegetation, with trees. Because it is important to know that as far as surgery is concerned, we come up against the mentality of the time. At the end of the 18th century, we are faced with two major problems. The first of these was the postoperative infection known as hospital rot. It is important to know that patients were in common rooms in hospitals, like in the Hôtel Dieu in Paris or in the different hotels in the big cities. I think you have one in Toulouse, there was one in Marseille. The patients were grouped together in large rooms. They shared illnesses and sometimes even their beds. One can imagine that infections were easily transmitted from one to the other. The second problem was the lack of anesthesia. Patients who had to undergo surgery had to be held by strong helpers. The surgeon performed the operation on a patient who was awake. One can imagine the personality the surgeon must have had at the time to remain impassive in front of a patient who was screaming under his knife strokes. To avoid surgical procedures, there were, of course, the conservative treatments with successive splints. Jean-André Venel had the first establishment built, dedicated to orthopedics, in Orbe, Switzerland in the canton of Vaud, where they carried out the orthopedic treatment of the different deformities. So you see here, everyone knows Venel's hoof, which you can see here. These establishments at the end of the 18th century and in the first half of the 19th century will flourish all over Paris, but also in Toulouse, Montpellier, Switzerland. In different places they will be created. And that's how we're going to treat scoliosis, rickets, club feet. You can see here the Venel's hoof, which was used to treat the club foot. When surgery was absolutely necessary, minimally invasive surgery techniques were used. But this is a concept that dates back a long time, as he performed the first tenotomy of the sternocleidomastoid for the treatment of torticolongenital. Jacques-Mathieu Delpech, a surgeon in Toulouse and then in Montpellier, was responsible for the first tenotomy of the Achilles tendon. May 16, 1816. Guillaume Dupuytren, in Montpellier, quickly follows him. This is really the beginning of orthopedic surgery. George Friedrich Louis Strohmeyer, a German who was very influenced by the work of Delpech, performs his first Achilles tenotomy 1831. He is considered the father of orthopedic surgery in Germany. William John Little was an Englishman who suffered from a club foot due to poliomyelitis. He obviously did everything he could to try to cure himself. He came to see Jacques-Mathieu Delpech in France, and then he also went to see Jean Friedrich Louis Strohmeyer in Germany, to whom he entrusted his club foot. It was successfully treated. In recognition of this, he named his first son Louis Strohmeyer Little, whom he was president of the English Surgical Society. William John Little, after whom Little's disease, an infantile paralysis, is named, is considered the pioneer of orthopedic surgery in England. William Ludwig Detmold was the son of the King of Prussia's physician. He obviously visited both Delpech and Little, then immigrated to the United States in 1837, where he built the first hospital for sick children in New York. For Americans, he is considered the father of orthopedic surgery. As you can see, these three men are obviously very important. For the French, if we are to consider our father to all, probably, we should talk about Jacques-Mathieu Delpech. If, of course, there is no mention of Ambrose Pare in the Renaissance. Here Detmold, on the famous day of October 16, 1846. Surgeon John Collins Warren performed this surgery at the Massachusetts General Hospital of Boston with surgeon John Collins Warren. Here we have William Thomas, who was a dentist converted to anesthesia who had just discovered the effects of nitrogen. The patient's name was Gilbert Abbott. Look at his neck, he had a small cervical tumor. So here we see Detmold attending the first general anesthetic. This operation was conducted in the amphitheater in front of surgeons. Everyone was absolutely amazed at the success of this simple and painless procedure. John Collins Warren, who ends this magnificent intervention, without forgetting that we are in America, by saying, "Gentlemen, obviously there were no ladies in those days, as surgery was forbidden to them. Gentlemen, this is not a charade." And it was the first recorded general anesthetic. It is obvious that in these conditions the news will travel all over the world at a lightning speed, and this anesthesia, conducted on October 16, 1846, was repeated a month later in London by Robert Liston for an amputation in December 1846. As for Joseph Francois Malgaigne, he performed his first amputation under general anesthesia in Paris in January 1847. So let's take a look at what a real operation looked like at the time. Thanks to this magnificent painting by Thomas Eakins in 1875, it can be seen as a surgical cure of a pathology of the forearm. Osteomyelitis was most common at that time. The anesthetist is seen holding the soporific sponge over the patient's head, probably soaked in chloroform. We see all the surgeons who at the time operated with their bare hands. This picture gives you an idea of what a surgical procedure might look like in the minds of all the people present, in which we witness the terror of the woman in the foreground, frightened by the surgery. It's understandable that she's scared because you see that bloody hand with the knife. We have a great privilege. There are two categories of people in the world who penetrate the bodies of their fellow human beings with a knife. The first category is us surgeons, and we do it in a desire to heal. The second category unfortunately does so with the intention to harm or kill. They are the murderers and the soldiers. Perhaps that's where we need to find the words that patients sometimes use, who feel that they have been failed by their surgeon. In consultation, they use the words that are heard in the courtroom. He murdered me, he slaughtered me, he ruined my life. Finally, we all see that surgery is also a place of education in these lecture theaters open to students, as this Zoom meeting can be today. Here we probably see Dr. Faust, who had known the time without anesthesia, who had to have this kind of detached look to be able to carry out the surgical act. A few years later, a pupil of James Syme, Joseph Lister, will treat two open fractures with a new method. In 1867, he published a new method for treating open bills in The Lancet. It should be noted that at the time, open fractures were treated radically by amputation, because an open fracture almost inevitably results in gangrene. Moreover, the medical statistics of the time report, according to Joseph Francois Malgaigne, that almost 1,000 of the finger amputees died. Joseph Lister applies antiseptic dressings directly on the open fracture wound. It turns out that he managed to cure 2 patients like that. He will say that he was greatly influenced by the work of Louis Pasteur. That everyone knew even then. The arrival of antiseptic surgery is anticipated, i.e., the preparation of the operating field with antiseptic solutions. Now, some 15 years later, William Stewart Halsted, who goes to visit Walkman. Surgeons in those days visited each other a lot, in Leipzig, Germany. He brought the antiseptic method that Walkman had learned from Lister in Scotland back to Edinburgh and then to London. William Halsted brings this antiseptic method to the United States. It so happens that during his operations he is assisted by Caroline Hampton, who is his first instrumentalist. Perhaps like many of you, he ends up falling in love with his instrumentalist, because he obviously works with her every day in the immediate vicinity. But it turns out that Caroline Hampton develops contact dermatitis to carbonic acid, which was used at the time to clean the surgical fields. Not wanting to lose her emotionally, wanting to keep her by his side for his operations, he tries to find a system to avoid contact with carbonic acid. He had rubber gloves manufactured by the Goodyear Company, which specialized in rubber tires. For Caroline Hampton, it turns out that by having these rubber gloves made which were sterilizable according to Pasteur's method, the rate of postoperative infections has dropped dramatically. This was the arrival of aseptic surgery, antiseptic for skin preparation and aseptic by the use of sterilized instruments and gloves. Sterile gloves came about thanks to the love affair between William Halsted and Caroline Hampton. He gloves her. The hands are therefore finally protected and sterile. We have general anesthesia and aseptic surgery. Surgeons can enter areas of surgery that have been almost forbidden until now, i.e. the abdomen, the thorax, and even neurosurgery with Harvey Cushing. Almost every area of the body will be able to be the object of surgical procedures. A major new discovery will change things again. In 1895, it was discovered by William Conrad Röntgen, who accidentally discovered rays that had never been named. These are the X-rays that everyone knows today are of interest in radiology, but also the therapeutic value. So let us take stock of the art of orthopedic surgery just before the Great War. As you can see, it was not long ago. That was just over 100 years ago. The art of orthopedic surgery is divided into three main areas: surgical treatment of fractures, arthroscopic surgery, finally, the field of arthroplasty. Osteotomies for rickets, ankylosis, dominate in an era without arthroplasty. William McEwen will perform various osteotomies. He even invented an osteotome, the McEwen osteotome. McEwen was a student of Lister. Lister was himself a student of James Symes, who himself was a student of Robert Liston, the man who conducted the first amputation under anesthesia in London. William McEwen will perform osteotomies as seen here on these stunted children, or congenital dislocation of the hip, or in vicious calluses or tubercular white tumors. In the treatment of fractures, William Arbuthnot will bring us the no-law-touch technique from England. Alain Lambat, a Belgian, will bring us the term osteosynthesis. William O'Neill Sherman, thanks to American industry, will develop biocompatible metals like vanadium. As far as arthroplasties are concerned, we are at the stage of balancing with a few anecdotal implantations. Themistical Gluck, a German, tried to implant prostheses made of ivory or wood, but these were failures. It is Jules-Émile Pien, from Paris, who will be a little luckier. Everyone knows the Pien claw. He will have a good result with his rubber prosthesis which he had made by his dentist. He had implanted it to replace a humerus affected by tuberculosis. You see what he wrote at the end of his 1895 publication. I will stop for just a few seconds to give you time to read these very topical conclusions. John Benjamin Murphy, the man who gave us Murphy's sign and bladder lithiasis. At that time surgeons were general surgeons. Here is what he says: mobility is important in the joints, but stability is also essential. Here we see him doing what is called modulating arthroplasty, by interposition of tissues, particularly facial tissues. Let's look at orthopedics as a clinical science. The very beginnings are due to Joseph Francois Malguigne and Claude Bernard, who was a pupil of Magendie. Claude Bernard wrote a remarkable book entitled Introduction to Experimental Medicine. He was responsible for the experimental method used in medicine, i.e. the one you all use to produce your clinical publications. With introduction, material and method, results, discussion, analysis, and conclusion. It was Claude Bernard who brought this to us. The brothers William and Charlie Mayo were inspired by this. They built the Mayo Clinic in the United States in Minnesota. Thanks to the birth of this establishment, contacts between European and American doctors could be re-established after the First World War. The whole body is accessible for surgery: the thorax, the abdomen, the central nervous system, and the eyes. Nothing escapes the surgeon's audacity, since everything is possible. Nothing escapes the surgeon's audacity, since everything is possible. As soon as painless surgery can be performed, antisepsis and asepsis, which have made it possible to limit and considerably reduce postoperative infections. Operative medicine, which has codified surgical procedures well. In the early 19th century, operative medicine was surgery performed on the cadaver before being performed on the living subject. Therefore, the operating techniques were well learned. It was necessary to go fast in a simple and safe way, therefore knowing the anatomy. The surgeons were so bold, sometimes so powerful, that they would write these things. Surgery has reached a state of absolute perfection that it will never surpass. The author was a well-known figure on the Parisian scene. His name was Jean-Louis IV. So obviously he was wrong, very wrong. Fortunately, the major advances of the century are not always due to the surgeon. It's always a team effort. It's the medical discoveries that will allow us to progress further, including the discovery of antibiotics with Fleming in 1928, the heparins that will enable to avoid those brutal deaths that followed the rising of the sick. Operated on, they were bedridden for several days, and when they got up, the surgeon had with enormous anxiety because sometimes a massive pulmonary embolism brings the patient down immediately. Immunosuppressants, the first of which was cortisone in 1949, will allow transplants, notably kidney or liver transplants. The first kidney transplant was attempted in the 1950s. The first heart transplant was performed by Barnard in 1967. Technological advances, of course, with biocompatible materials, which will pave the way for prostheses, be they articular, vascular, or other. Miniaturization will give a new impetus to surgery, particularly arthroscopy and percutaneous surgery. Let's review the three main areas. Surgical treatment of fractures with the birth of the Maurice Muller Association for Osteosynthesis in 1958. And of all his acolytes, Hans Willenegger, Hans Robert and Martin Al Robert Schneider, Martin Allgauer. Rigid fixation to promote consolidation and mobilization. Obviously, in these processes, they were very influenced by Gerard Kuncher or Robert Danis, the Belgian, who will bring his philosophy of fixing fractures with plates and screws to enable early mobilization, but all the AO team went further to rely on these four pillars: good documentation of fractures, good research, a specific instrument, and, above all, a rigorous and continuous education. The basic course, the advanced course, which was in Davos in Switzerland, in Bern as well. Obviously the initiative of Maurice Muller. This led to a school and even the establishment of an industry dedicated to osteosynthesis spread throughout the world. Arthroscopy was first introduced by Severin Nordentoft at the end of the 19th and the beginning of the 20th century. But the one who really started to make a name for himself was Kengi Takagi around 1920. And finally Masaki Watanabe, who came to the SICAT Congress in Barcelona in 1957 with a remarkable atlas of articular anatomy seen from the inside. Masaki Watanabe developed arthroscopy. He performed the first meniscectomy in 1962. Arthroscopy has been developed since the 1970s. In the early days, it was the rheumatologists who performed the arthroscopy, if by chance they could get a short hour at the end of the surgeon's schedule. At the end of the day, if they could have a little space to put their cameras in the joints. And look at why the patient had an unidentified joint problem. All the 70s and 80s were diagnostic arthroscopy. Robert Wilson Jackson, Lanny Leo Johnson, and Henri Dorfman founded the French Arthroscopy Society in 1980. Johnson will develop arthroscopy, especially in the shoulder area. All the joints will be able to be invested. Since the 1990s, in the knee, we moved on to arthroscopy for therapeutic purposes. Today, no anterior cruciate ligamentoplasty should be considered other than under arthroscopy. If by misfortune we do it in the open, the interns look at us as if we were part of the 17th century. As far as arthroplasties are concerned, the very first steps were taken by Marius Nygaard Smith Peterson, who in the 1920s implanted small glass beads in the joints. He would remove the head, in its place he would put a glass ball, because he realized that by slipping a glass ball under the skin, a kind of fluid membrane, a kind of serous bursa, was created around it. He would then remove the glass ball after a while. This allowed for mobility in the joint and length through the fibrous tissue. The brothers Jean and Robert Judith, at the end of the 1940s, made their butterfly prosthesis in acrylic. They have written a remarkable book on hip arthroplasty. Austin Taylor Moore and George Kenneth McKee are going to create prostheses that are going to be a little more durable, a little more sustainable over time. The Moore prosthesis was still very, very common in France 20 years ago, and probably still exists in various less developed countries. John Charnley brought us, in the early 60s, his concept of low friction. He will tell us that the hip prosthesis will have to use an acceptable interposition material and an effective fixation method. And there he will develop the cement. It is worth noting that this cement was already developed by dentists. You would think that they would be essential collaborators. As we have seen, the first anesthetist was a dentist, William Morton. The first shoulder prosthesis fitted by Jules Émile Pien was designed by his dentist. And finally, cement was invented by William's dentist Sir John Charnley. The cement around the prostheses should be accompanied by a low infection rate. In knee arthroplasty, a major problem was that of stability. At the hip, stability is essentially muscular. At the knee level, this is not the case. When the knee was opened up to put in a prosthesis and part of the ligaments were removed, this caused a major problem with stability. The very first prostheses that were developed were hinged prostheses. That of Borga-Waldius and that of the Guipard group in France for the groupe d'utilisation et d'études de prothèses articulaires. Following a very interesting thesis by James Morrison in 1967, whose title was, "The Forces Transmitted Build the Human Knee During Activities," that Frank H. Gunston and John N. Zoll have taken a scientific approach to knee kinematics. They made it possible to develop the prostheses we all use today. Sliding prostheses, i.e. resurfacing prostheses with cuts, which allow the preservation of a part of the knee ligament envelope. What will the orthopedic surgeon be like in 2050? If we can afford a look at computer-assisted surgery, we may be operated by robots and computers. Everyone knows the robot Rosa or the robot Mako. Computers are ubiquitous in the operating rooms. They help with preoperative planning. Information is no longer obtained by going to the surgeons, although I think it would be a good thing to continue. Go and get impregnated by visiting surgeons in their homes. Kinds of information can be found on the internet and on YouTube. You will be able to see all the surgeries you want. Finally, the collaboration of our biologist colleagues is obviously indispensable. We saw that thanks to the chemists, we were able to have heparin, antibiotics. Well, today geneticists and biologists are looking at on the genome outright and deliver stem cells. Tissue engineering will allow us to make synthetic tissues. Molecular biology will enable us to make further progress, in any case that is all we hope for. The sake of our patients. I will end this little presentation by giving you 2 sentences for reflection. The first one by Christian Albert Theodor Billroth that everyone knows. He was a German digestive surgeon of the late 19th century. The man accustomed to the past of art and science is competent to apprehend its future progress. As for Maxime Leinhold, who wrote a remarkable work in 3 volumes on the history of medicine. Our truths of today are the errors of tomorrow, and our present knowledge is neither better nor worse than that of our predecessors. I thank Philippe for mentioning my book, which is about 100 pages long on a brief history of surgery. For those who are lazy, the Edie's editions have produced a small guide, which you can buy at any petrol station of France's motorways. You see, this little history of surgery guide that folds out is really extremely short. And I will end by thanking you for your listen carefully to this little picture of Marseille, which will see it is like Toulouse and all French cities, well contained with all the ferries stranded in the coronavirus outbreak. Thank you very much, and thank you again, Philippe, for allowing me to express myself on this subject, which is obviously close to my heart.
Bravo, bravo, it was not only documented, but fascinating, and you really have a gift for storytelling. We'll listen to you for hours, with lots of anecdotes, and at the end you don't listen to us anymore, then we look at the slides. In the books I really liked, Princes of the Blood, I don't know if you have read it.
Not only have I read it, but I know its author Gilbert Schlobel very well, who is a colleague of ours, a friend of mine too. I have had the opportunity to give many lectures on the history of surgery, and I did one with him called When Art Tells Medicine. I could make it for you one day if you are interested.
Blood Princes is really good. We won't go over everything again because we could develop each of the chapters. What I looked at was the age of death of orthopedic surgeons. Nicolas André has reached 84 years of age. We were proud that Louis XIV lived to be 80 years old. 84 years old was an achievement. André has lived through the centuries, but the others died before they were 70, if not 60. Which is still the average for orthopedic surgeons today. Jean-Louis Tricot told us that many well-known orthopedic surgeons died a violent death, murdered by their patient.
Of course, Jacques-Mathieu Delpech, the first of them, who had a patient who was unhappy with his operation for hydrocele, was shot by his patient. But it is not the only one. One was thrown down the hospital stairs. Samuel Pazzi was also murdered by one of his patients. Everyone knows the Pazzi clamp. He was murdered by his patients, Jacques-Mathieu Delpech too. We are in a dangerous business.
I think Ollier was also murdered by a patient. Michel Rungiers. Ambrose Père died at over 70 years of age. But for their time it's incredible. It is even more astonishing because he lived in the 16th century. Hippocrates is said to have died at 90. I don't know if it's true.
The centaur Chiron was immortal before he took an arrow from Zeus. Well, that was really exciting. Do you have any questions on the subject?
But I wanted to make a small remark. I really liked your presentation. I don't know if you know me. Of course we know each other, Jean-Louis. We are several times the table together at Club Nicolas André. It is not Jean-Louis but Michel Rungiers. It's Michel here because earlier I called Jean-Louis who didn't answer. I wrote a book in which I have several chapters on the history of anatomy. Among others on Ambrose Père and surgery in the Middle Ages. An epistemological approach. What makes ideas really change? In the 21st century, 20th century, it is frankly the discovery, materials and advances in technology. Because surgeons have always been daring. You were talking about trauma, which is very interesting. I have had exchanges with Mercer Rang. You will surely be familiar with this beautiful book on the history of orthopedics by Mercer Rang, an American, who attributed the understanding of epiphysiolosis to Ambrose Père. In fact, it was Hippocrates who understood congenital hip injuries. It's an extraordinary thing. Hippocrates, however, only admitted external causes of pathologies, apart from the humors, sword stroke, etc. But what you have said is very interesting, the interplay between the surgeon and then the aseptic, the glove, etc. I tell the interns about the progress of surgery. It is antiseptic, anti-antibiotic, analgesic and anesthetic.
En fait les anesthésistes sont utiles. I have a small remark about the plates. You told us that Danis was very fond of the plates, but he is far from having invented them. There is Lambot who was born around 1850. I have talked about it absolutely. Yes, but at the time, it had no aseptic or anesthetic. So he was putting plates in difficult conditions. If we go to the Montpellier Museum, which is magnificent, there are Lambot's plates in a display case. They are asymmetrical with self-tapping screws and made of copper, which is a good biocompatible material. So Lambot's plates could practically be put on today. Except that he was putting them to the test and that it had to happen more or less to put them. I also have a small remark to make about the internet era. And as you said, the proof is that we can talk to each other from town to town, from house to house. But what amazes me is the speed at which, while it took almost 2 months to cross the Atlantic, a novelty that was on one side or the other of the Atlantic was used within a year by European surgeons, e.g. English, French, German and vice versa. In the story about anesthesia, you can see that it happened very, very quickly. A year later it was done, absolutely incredible. They were talking, they were writing. Absolutely, we see it with mathematicians. Because Pierre de Fermat wrote to his colleagues of his time and advanced mathematics by mail. And then they would see what others were doing. Regardless of borders, political ideas, it was quite extraordinary that. Extraordinary the speed at which it spread.
Quite it was remarkable. First year anesthesia in October 1846, in December 1846 in London, and in January 1846 in Paris, Malguigne, who was doing an amputation.
I have a 150-year-old medical surgical encyclopedia, where it is written, whenever a idea is put forward, information is provided on the surgeon, where he is, what his background is, what his studies are. Its different nationalities. I.e., they knew each other when there were few publications.
Jean-Louis Tricot. As you know, just before Nicolas André we talked about Quillet had determined the Calopedia, the art of making beautiful children. And we almost called ourselves Calopedists. So here I took the book of Quillet. And as you know, just before him there was Civil de Saint Martha, who was a poet and who was also the mayor of Poitiers. This is my point. Indeed, Sevely had written a book in 1797 before Leandri, The Art of Feeding and Raising Children. When I read it again, what amused me most was that Civil de Saint Martha died at the age of 87. He was for 2 years mayor of Poitiers. When you read one of his poems he says, however, let us rest our pen. And after rising to heaven on the wings of Pegasus, despising the earth. So there is a current environmentalist in Poitiers who did not know the old ones. Mayors who dreamed of the sky and of taking flight. He had spoken as a term so before Nicholas, so it is well known that there were 2 of them. Others who have done a little to redress children. About the ecologists, I have the impression that in Poitiers is an environmentalist city, that the mother is also environmentalist Leonard. Yes, that's why this mother who has said he didn't want children to dream. Here's the fun part, so.
And we almost lost a number of orthopedic surgeons as well, following Jacques-Mathieu Delpit, who renamed orthopedics to orthomorphics.
It's silly because we're not orthopedic surgeons. You don't straighten up children every day and maybe never. But it is the one that has taken root. Yes, surgery of the musculoskeletal system, for which the acronym CAL would seem very appropriate. I see that you have the Golden Gate in Marseille.
You see, I'm doing a conference live from San Francisco.
In the little anecdotes there is also the notion of prevention according to the means of their time, which was said earlier. When something new comes along, it is quickly adapted to medicine. When electricity arrived we tried it, electrotherapy. Which may still be something for the future. In Toulouse you mentioned the Hôtel Dieu, which is a very old hospital. And this Hotel God was on the other side of the Garonne outside the city. From the Hotel Dieu, a bridge led to the other side of the city. And anyone who arrived in Toulouse who was a foreigner had to have some sort of medical checkup. He was seen in this God Hotel. If he appeared to be ill, he was not allowed to enter the city. He stayed in a large room called de Pas Perdus. The route of St. James of Compostela passed through Toulouse. They had already walked a lot and their feet must have been in a terrible state. Or any other disease that had decompensated. Absolutely, and that was 1,000 years ago. It's a good idea not to let just anyone into a city. This is currently being experienced with the epidemic. C'est terminé. Merci beaucoup pour cette belle histoire. À bientôt sur les conférences d'orthopédie de Toulouse.